Well, I won't back down. No, I won't back down. You can stand me up at the gates of hell, but I won't back down. Gonna stand my ground. Won't be turned around. In a world that keeps on dragging me down, gonna stand my ground. And I won't back down. I won't back. Hey, hey, baby. There ain't no easy way.
And welcome to I Protest. This is Donald Jeffries coming to you live streaming over Facebook, Twitter, and YouTube, and on Rockfin, America Unplugged over there. So every Friday at this time. We have a couple guests today that I'm very anxious to talk with. Obviously it deals with the problem that you all know if you listen to me, what I've been experiencing this year and what happened in January with my brother. So we're dealing with a couple of guests who also have dealt with the hospital killing fields and the horrible medical care and the COVID protocols and all that. So we're going to talk a lot about that. Nicole Landers is with the Truth for Health Foundation. She's their nursing legal advisor there. So she's going to talk about, first of all, her work with Lori. Lori Simpson is the other guest whose husband is presently in the same hospital my brother died in, Fair Oaks Hospital in Fairfax, Virginia. So I hope there's a better outcome there for you, Lori. So welcome, both of you, to the show.
Thank you so much for having me.
Well, it's my pleasure. So I guess, Nicole, you want to start and just talk a little bit about your organization and how you came into contact with Lori?
Oh, sure, absolutely. So Truth for Health Foundation is a 501c3 public charity. We give a voice to the voiceless. We serve the public with education related to all health issues, especially early treatment. And we also have a COVID strategy team, which I direct. And the purpose of that team is to help with medical rescues and support for patients and families that are imprisoned in the hospitals. I serve patients all over the country and their families who are facing medical abuse and essentially medical kidnapping, which is what Lori and her husband have faced at Inova in Virginia. So Lori came to me by way of our foundation lead attorney, Todd Callender, after her husband experienced just really profound abuse in the Inova system. And we've been working together, I guess, Lori, for about a month now, trying to strategize ways to get her husband out and home and safe where he can get effective and safe care.
So okay, Lori, so why don't you tell the story? It's obviously different than my brother's. My brother went in the hospital on January 6th, and he was a hypochondriac, and he called an ambulance for not a valid reason, which he had done before in the past. And unfortunately, I wasn't there to stop him. And once he was in the hospital, they gave him the PCR test. It's 90% false positive rate, as you know, supremely flawed. I'm sure the first question they asked if he was vaccinated, he said no, so they fast-tracked him. Lo and behold, he tested positive for COVID and had no symptoms at all, and he was dead in 2 weeks. I didn't get to see him one time because there's no visitation allowed there. So I'm still trying to recover from that because it was so quick. Yours has been a little bit different because yours has kind of been drawn out, and unfortunately your husband's still alive. So tell us how this all began and where it stands right now.
Well, it's been 58 days, and it's been a very difficult 58 days for both of us, but certainly for him. We tried to avoid the hospital at all costs because we knew they were killing fields, and we knew that we needed to have things prepared before we even left. So the morning I needed to call the ambulance, we did a medical power of attorney, and that included his wishes not to be on event unless he coded, and also not to receive remdesivir. He actually was testing positive for COVID on the 19th of December, but then because he was using ivermectin, hydroxychloroquine, and steroids and all the appropriate treatments, he pretty much cleared that within a week. He had 4 negative tests, including a negative test on the morning of the hospitalization. The hospital accepted my verbal that he was positive on the 19th, but when I told them about the 4 negatives, they said, oh, that doesn't matter. And we even took the cards from the test into the hospital with us because I wanted everything to be proven. They subsequently admitted him to the ICU. They did a expired EUA PCR test. It came back only presumed positive, and it said that couldn't differentiate between SARS-1, SARS-2, or any other coronavirus. So it was really inconclusive, but they used that test to isolate him for the next 20 days to keep me out and to begin to decimate his body and write COVID pneumonia all over the chart. Eventually, they relented because I pushed that, he really was going in there with aspiration pneumonia. I watched him aspirate on the 30th of December. We were doing chest work. He was on his back, he vomited, and I heard and saw the aspiration. And I've seen that before. So it was definitely aspiration pneumonia, but they refused to treat the bacterial component for the first 33 days. Eventually, we were able to beg them for doxycycline. He had a short course of Levaquin that didn't do anything. They initially also started him on a Pfizer antibiotic. In the beginning, it was a short course that didn't do anything. But the doxy brought him down to near normal levels of white blood cells and neutrophils. But by that time, he had already lost most of the weight. He's down 52 pounds. He's extremely weak, lots of muscle wasting, and just standards of nursing care were not followed. And I was told by the ICU nurses that I didn't get to ask questions, I didn't get to direct care, and they're the experts, and I just need to accept what they have to say to me.
Well, I think that's the first. I know that's the first thing that gets people in trouble is when they question, because they don't want you to question them at all. And if you express a knowledge, especially if you mention ivermectin, and you say the remdesivir, and in my case, my brother, I told them expressly, no remdesivir, no vent. They never put him on a vent, but they, unbeknownst to me, they had started giving him remdesivir 5 days before he died. And that's literally what killed him. I don't have any doubt in my mind. But what can I do? I had nothing on paper. You said you had a power of attorney. I didn't have that. My brother just kind of always looked to me to make the decisions for him. But you had something on paper, right? Did you? So, because they ended up giving him remdesivir as well, right?
No, he didn't, to my knowledge, get remdesivir.
Oh, okay.
We had very clearly stated.
Well, it's probably why he's still alive. Yeah. Okay. Yeah.
Right.
Yeah.
Although the ER doctor initially asked me, was he vaccinated? And why don't we want remdesivir? And then they began to write that we use non-traditional COVID treatments, and we were refusing the COVID protocol, which we were. But he wanted me to explain to him why we were refusing remdesivir. I cited the studies, the Ebola studies and everything else that we all know about, and he just rolled his eyes. And then they started to wheel him away to admit him, and I said, wait a minute. I don't know how soon it's going to be before I see my husband again. I'm going to say goodbye. You're going to wait a moment. So that was my first interaction with that hospital that probably didn't go well when I didn't let them just move him away.
Yeah, well, you've had a lot more experience with. Well, you've been. This is 50. So he's basically lost a pound a day. You're saying that's horrible. So has he not been eating? They don't have the feeding to what? Because near the end they were claiming my brother couldn't. I don't even think they were feeding him. And I said, again, when you're not allowed to visit, it's hard questioning. The doctors are hard to get a hold of. They're very dismissive. Nurses are you're hit or miss. Some of them are nice, some of them are not, and they don't know everything. You've had a lot more time here. I mean, mine, it was just wham, bam, and he was gone before I knew it. I had no idea that he was going to die, and then things got so bad at the last moment. It just hit me like a ton of bricks. In your case, you've had a lot of time to adjust to this. So tell us a little bit. I've already heard, I saw your interview with Stu Peters, and I know you've had some very bad experiences with nurses and doctors. To talk about a little bit about that, how frustrating that is.
Well, they did a nutritional assessment on the 12th of January, but they didn't add any supplements. They didn't do anything to support him. They didn't feel they needed to. And the blood values and the infection things, when I questioned them, they didn't feel they needed to treat any of that either. We've had nurses write false quotes in the chart about things that they said I said that I didn't. The most egregious note was written on the 21st, and it said that I tried, that I had touched his endotracheal tube, that I refused to step away from the bed, that I didn't report to the staff that his endotracheal tube was loose on his face, and nothing could be further from the truth. And they added other things to the note that were completely falsified, that I released the restraints to do range of motion. I had been doing range of motion, but it was supervised. They didn't want me to, it's very important for someone on a vent or someone on bed rest, but they didn't want me doing that. The first 3 days he was back in the ICU, I was encouraged to do it as much as possible. And then the nurses that kind of were against us came in and reprimanded me for that. But because of the note on the 21st, I was banned the next day in a very cruel way by the hospital CEO. And now we have discharge planning saying that I can't come in for teaching to bring him home because I tried to remove his endotracheal tube, which nothing could be further from the truth. I had my hands on his cheeks to protect his airway because the nurses were not even there. Our nurse wasn't even on the unit. The other ones had not come in. We were waiting for respiratory to mosey on up to the floor, and he was in distress. So that's how.
I'm confused that you were able to, because this is the same hospital my brother was in. So he was diagnosed with COVID pneumonia. So was my brother. But you were able to, because they told me no visitors to COVID. I'm amazed that they let you in at all.
Well, after day 22, he was actually moved off the ICU. He was released from isolation. Now I kept sending in my antibody reports, my T cell reports. I mean, I have more antibodies than anybody I know, just because of the people that I've helped in the church and everything. But they didn't care that I was fully immune. I still could not see him, but we were able to talk 5 or 6 times a day then. Since I've been banned, we haven't been able to communicate at all. It's been almost 2 weeks now. And he doesn't, I mean, people have told him where I am and what happened, but I don't know how much information he's really getting.
So you can't talk to him on the phone now either?
Well, he has a trach, and he doesn't have a passive.
Right.
He can't speak. And up until today, he was so edematous that he didn't have the dexterity to write or text. We just took his phone back today. The day he went back on the bench, they packed up all his belongings, his glasses, his phone, all his personal items, and made me take them home. And I said, why am I taking his glasses? Why am I taking away things that he depends on? And they just said, he doesn't need them. You take them home.
Right. Well, it's an awful story. You have to hope that you have a better outcome. But didn't they also say that I thought I heard that they threatened to arrest you if you came on the campus?
Yes. They had 3 large men at this meeting. I was supposed to just meet with the unit manager to tell my side of the story. But when I arrived, there were 3 really big guys over 6 foot in the lobby waiting for me, who then escorted me back to the CEO's office. And they just immediately said, your visitation is suspended. And then the one gentleman followed me out to the porte-cochere of the hospital. I was already outside. I put up no resistance. And he reached out for me. I think he wanted to hold me and tell me that if I came back on campus, I would be arrested for trespassing. But I didn't let him push me. I just pulled away, and then he tried it again, and then I just ran to my car. I did not feel safe at all.
Oh, it's on tyranny, and we're having comments in the chat room. Carolyn says, she talks about COVID to remove the family. I think that's a big component. And Nicole, I want you to address that. But the idea that you can't visit, because that was, in my brother's case, that was the main culprit, because I wasn't able to see what was going on. I couldn't monitor things right. My brother was easily confused. He couldn't tell me really what was going on at all. I didn't get mixed signals from him, and I was getting mixed signals from the nurses, the doctors both. And I could, if I'd been there to be able to monitor, I could have looked at his charts. I couldn't do any of that, and I don't think it's a mistake, Nicole. This is pretty obvious what they're doing here. This is a big financial racket, and by keeping the families away, they make it a lot easier, especially with older people, to follow the COVID protocol, which unfortunately ends up killing them a lot of times.
Well, it's very cunning, isn't it? 20
Yes.
days without the benefit of familiar family contact and advocacy is enough to undo anyone, isn't it?
Yes.
It's a completely irrational plan and protocol as well, since you know, the only one that's possibly at risk is the visitor, and if they're taking it upon themselves to come with protective gear, it's no different than any other staff member that goes in and out of that room. It really is. I call it a protocol of death, and unfortunately, it's copycatted everywhere in this country, with very few exceptions. Families are excluded for 20 days, which violates the patient's Bill of Rights, which supports the patient having advocacy. And when we think about it, every one of these patients has become medically disabled. They fit the criteria for a disability and are entitled to advocacy from their family. Yet alone, that isolation is just destructive to the heart, mind, and body.
Yeah, and Lori, Chris Buchan in the chat room says, "Have you tried to obtain a court order?"
Well,
you hear that, Lori?
I'll speak to that for Lori. It would be wonderful if we could obtain a court order, but I think at this point, Lori, we're up to 8 or 9 attorneys. Not one was willing to take the case. Not even one. I even have a second licensed attorney from outside the state. So I now have 2 licensed attorneys trying to find a licensed attorney in Virginia. No one will come to John's aid.
Yeah, and that's the problem, isn't it? Is that this? I mean, I write about corruption way beyond this, but the legal corruption is just as obvious as the medical corruption, and they cover for each other. So no one can be sued for these things. And you go back to vaccines, all the people that have been harmed by vaccines and die, there's nothing they can do about it, because under the 1986 Act, which a young Anthony Fauci was in the middle of, they can't sue the vaccine makers. So unless something changes, there's nothing. Go ahead.
And in the case of the vaccine, they aren't actually covered under the 1986 Act. They're covered under the emergency use authorization, and they actually violated the terms of that agreement. They actually have voided their liability shield, and that can be proven, and they will be liable. It's a matter of having attorneys willing to stand against this insanity and file claims. The FDA themselves violated their own regulation in the case of the vaccine injury. In the case of what's going on here, this is driven by the CARES Act and the PrEP Act, which negate the federal patient's Bill of Rights.
Yeah, there's certainly, because there's so much that was wrong with hospitals. Why am I getting an echo? Tony's not there. And I was hearing an echo from you too. Suddenly I have an echo. Chris says his name is pronounced Bucket. Okay, thank you, Chris. But Carolyn in the chat room talks about hospitals in general. I have a lot of experience before that, having worked in the hospital early on when I was young and seeing a lot of things with my parents and everything. I've never understood, the fact they're not allowing any visitors at all now is awful, but I never understood visiting hours to begin with. Why can't you visit your loved one whenever they want you there? I mean, they've always been very authoritarian and tyrannical about things, but it's out of control with the COVID.
It is absolutely catastrophically out of control. And they've been working on this for a long time.
Absolutely, and they've used this that. Where's Tony? Tony, I hope if you're listening, I'm getting some real in the chat room. Kat or Chris, anybody's there? Can you tell me? Are you hearing some feedback? I'm hearing everything I'm saying, and I heard anything Nicole was saying as well. Lori, why don't you say something so I can see if you get feedback too? I can't hear Lori. Actually, I can't see her either. She's grayed out. Okay, hopefully Tony will come back. because this is beyond me. Yeah, Prairie Fire says he's hearing an echo. Yeah, we're hearing echoes. I don't know why that is. It wasn't before, but okay, we'll try to muddle through this. It's just kind of distracting, but um, so talk a little bit about Nicole. I'm sure you're familiar with how profitable all this is for the hospitals. Now, Lori's husband has been there for 58 days. And one thing I found in the case of my brother, they forgave the hospital bill, which is, I'm hearing from more and more people they're doing that. One woman was in the hospital for 40. Okay, I'm not hearing the echo now. Good. So Tony must. Well, Chris, I hope you don't hear it now. He said I don't hear it now, so I think it's fixed. But they never do that. They'll hound you to death for a $50 bill. I heard from a woman that was in the hospital. It survived for 45 days. Never got a bill last year. Unheard of. So I would say it would be interesting for Lori to look and see 58 days. Again, you're talking about a lot of money. Will you get a bill? I suspect you won't. I think that's all part of this thing that they're trying to maybe make it easier for the parents of the family to accept. Oh, hey, they waive the hospital bill. They're good people. I mean, what's your understanding of that, Nicole? Have you heard that? Because that's just very uncharacteristic of the medical industrial complex.
Well, from other families nationwide, I haven't heard of a hospital forgiving any bills, but we do know, and this is very easily researchable by anyone in the listening audience, go to the CMS Centers for Medicare and Medicaid. The hospitals are given financial reward for every COVID admission, every dose of remdesivir, every ventilator, and every death, up to the tune of about $100,000 per patient. They receive a financial reward for this protocol. They do not receive any financial reward if the hospitals were to use any other treatment. And I'm pretty sure that's why there's only one treatment put forward, a very expensive one at that, and also one that's not proven to be very effective, rather deadly. But there is financial reward to the institutions for using this protocol.
Yeah, and we have two Chris's in the chat room, but Chris Graves talks about FEMA's offering to pay for the funeral as well. I can testify to that. I'll have more to talk about that. I don't want to talk about it right now. So Chris, fucking, it is true. They're doing, and again, when the government gives money to anybody, very unusual. And when hospitals and the medical industry forgives debt, unheard of. And they're doing it now. I think I think it was Canada, but that is forgiving all ambulance charges for COVID. As long as you have COVID in there, they're forgiving it. And they're not doing it for people with cancer, rolling up huge bills. Not at all. Heart disease, whatever like that. But COVID there. Now, why would that be, Nicole? What do you think? What's different about this, I wonder? Is it just because they're making $100,000 a patient, which they're not on those other things?
Well, I can't speak to motivation, but I think the facts speak for themselves. If you're getting a huge financial reimbursement for one specific course of treatment, it's a pretty powerful positive reinforcement for the institutions to follow one course of treatment.
Right.
All in unison. And I would add to the listening audience that I get contacted by countless families across the country, all seeking to file med mal claims. And medical malpractice is driven by deviations in standard of care. So when the standard of care is reset and everyone's doing the same thing without exception, there is no medical malpractice in the eyes of the law. That doesn't mean it isn't malpractice, it's malfeasance. However, you can't prove that in a court of law when the same physician under similar circumstances, they're all doing the same thing. The same thing in the case of COVID care is admission, isolation, deprivation, removal of food and fluids, being kept in rooms where they aren't cleaned, the sheets aren't changed, and eventually the patients become despondent and sick off remdesivir, ventilated, and they die. I see it countless times all over the country, it's the same thing every single time. Meanwhile, while the patients are suffering and dying, the hospitals are getting financial reimbursements for the plan of care. So,
Yeah.
collectively, it sends a pretty powerful message.
Sure, it doesn't. I've Lori, trying to get her back in. Lori, can you hear us?
I think
We
Lori
can't hear her.
somehow
So I can.
got bumped out.
Yeah, she's grayed out. So I don't know why she shouldn't need Tony to enter the studio. She keeps getting knocked out and then trying to come back in. But if it's giving you anything about enter with audio or video or something, make sure you select that. But you should just be able to go right in the studio. Tony, if you're listening out there, we're having trouble. Lori is grayed out and we can't hear her. Nod your head. Can you hear us, Lori? I think she nodded. Okay. So
She said she's stuck backstage.
Yeah. Okay. So you click enter studio and you can't come in. We didn't mean to keep you in the green room. I swear. You can't. Okay. I don't know. Well, Tony, if you're listening, maybe you can fix this. I can't do anything. I'm lucky I can get myself on here. Yeah, believe me, I'm incompetent. I can talk. That's it. But we'll hopefully hang tight. Hopefully Tony will be here and maybe you can fix it, or I don't know what to tell you. But Jordan, good to see you in the chat room. Another friend here. So we're talking about the hospital killing fields, as you probably figured it out. So, and I want to get more from Lori, whose situation we were focusing on. But Nicole, you hear? I mean, I hear since my brother's death, or even before that one. I thought he was sinking. I started writing about it and I'm talking about it, and I've heard from so many people all over the world similar experiences. Well, lots of people just offering condolences, but a lot of people that are same experiences. I imagine you're hearing from lots and lots of that. What's your sense of the numbers here? I mean, some people in the conspiracy world think there could be millions involved. I don't know, but the death rate overall, we know the insurance companies told us, have gone up 40% since last year, which is that's like one of the biggest stories of the century, unprecedented. And even their fake COVID numbers, which are based on nonsense largely, even if you accepted all the ones that died of COVID that did, like my brother, people like that, even if you did, it doesn't possibly come up to adding up to 40%. So what do you think's involved there? And I think Lori's back. So if you can answer
there's
that.
Lori. So Don, in answer to your question, I wouldn't even want to begin to count. Here's what I tell every family that I work with. The failure here is a failure of early treatment. The patients are denied access to early treatment, and the physicians and medical professionals are failing their due diligence and their oaths to do no harm by not being properly informed. The information's out there. The onus of responsibility is on them. And if any one of us were diagnosed with cancer today, we would have opportunity for different treatment options and second opinions if we didn't like the course that was presented to us. With COVID, there's only one course, and it's one that's proven to be unsafe and ineffective, but there is no choice when it comes to COVID. So I feel like the numbers are probably fairly high. It's definitely not proportionate, but I couldn't speak to exactly how many it is. I just know that there's an awful lot of hurt out there. And of all the patients that I've cared for, I personally have only seen 3 now survive remdesivir.
Wow. So Lori, sorry we lost you, but you're back. So what do you think about what we've been talking about?
Well, the first thing they did with my husband, John, was stop his hydroxychloroquine. He wasn't on it for COVID. He was on it because he travels and he uses it as a maintenance drug for inflammation. But they stopped that. They said they had to because it wasn't on the protocol. The next thing they did was stop his supportive supplements. And then as soon as he went on the vent, they took everything away, even though they were home medications. So according to the patient rights packet that they handed me, he should have been able to continue to take them. I also learned in the patient rights packet, which was pretty much null and void, I don't know why they gave it to me, that I could have received a family pass or a companion pass, but I was denied that 5 times. That would have allowed me to come in, not those first 20 days, but at least during non-traditional visiting hours. Their visiting hours, as you probably know, are 1 to 5. That encourages
That's
only
ridiculous.
retired people, not people who have to go to work. So that's been a problem.
Right.
But they
Yeah, and
also
what
wrote.
we talked about, I don't know if you heard it, but
Mhm.
I was just going to visiting hours. That's always been I question everything, and I've never
Yeah.
understood the visiting hours thing. You ought to be able to, and most of the nurses most of them are okay about that until COVID. But most of them would say, "Oh yeah, we're not really paying that much attention to it." But you should be able to visit whenever you want. It's your loved one. If they want you there to comfort them, to me, that's an essential part of getting healthy.
Right.
Well,
You mentioned billing. We have already begun to receive bills. I have no intention of paying them, but
Oh,
we have begun to receive them just
well, I
today.
wouldn't. I suspect, yeah, I'm sure you wouldn't intend to pay them anyhow, but I suspect that they're going to waive those bills because what I'm saying, like in my case, they waived the remainder of my brother's bill. They sent me a letter, which was shocking enough. Well, of course, they addressed it to him, and
Mhm.
they thanked him for the honor of caring for him as they killed him. So it was typical insensitivity and just incompetence in their billing office, which it's one thing. But then the next day, I got a letter. And I never pay like you. If there's a code, I don't go very often, so my medical bills are very small. There's a couple $100 that I refused to pay for years. They waived that too the next day, and I thought this is really interesting. They never waive medical bills at all. And I don't know if you heard, I was talking to a woman she survived this ordeal, but she was in the hospital for 45 days. Never got a bill. Imagine what the 45-day hospital bill would look like. So I've heard a couple other people saying, well, I'm suspecting that this is part of what they're doing to try to, well, look, we waived a $1,000 bill or something, and most people, the same people that are falling for this, would be grateful for it. So I know it won't work in your case, but I just, I wouldn't be surprised if you got the bills.
Well, Nicole also mentioned the things that they're getting bonuses for. So as soon as they put him on the vent the first time, and the informed consent that I got that day was you need to put him on the vent or you need to make him a DNR. That was the total of the informed consent. So he was on the vent for 6 days. He was extubated. Then they sedated the heck out of him with a surgical sedated drug. He's very sensitive to sedatives, so he was unable to clear his carbon dioxide. So 4 days later, I got the same call with the same informed consent that he was going back on it. But the doctor is now writing that he failed extubation twice. It's almost like they added an extra vent opportunity in there for extra money in that particular note because he wasn't extubated twice, he was extubated once. And I see all kinds of OT and PT notes that never occurred. There's so much in that chart that is not correct. I watch it through the portal every day.
And how many, this is the important thing to consider, is probably, I would say, 90+% of the people are not like you. They're not going to be noticing that. First of all, they may not be knowledgeable enough to know what it is but most people are, again, they're trusting the white coats. Well, they must, who am I to check up on them? But so you're noticing these mistakes. So how often these happen? I mean, it's probably common. So who knows how often it actually happens? We know the medical profession, hospitals and doctors are the third leading cause of death in America. I think they may be number one at this point if they, depending on how many have actually died in the hospitals. But I'm glad you're taking, but again, they resent that, don't they? Once they know you're looking at this and you have knowledge of it, the attitude comes through loud and clear.
Yeah, I can't see everything, but I can see progress notes, I can see labs, and I follow them diligently all day long. And that's how I found out that they changed his code status in the middle of the night. They came into his room, a nurse practitioner came in at 11:30 and said, "You want to be a DNR, don't you?" And the CEO came to the room the next day to reprimand us, and I brought that up. I called immediately. I called the next morning. I kept calling, and I said, his code status is not DNR. It never has been. The CEO of the hospital said, "Oh, no, his code status has been a DNR since admission." Now, how the CEO of the hospital would know his code status is curious to me, but we were able to get that corrected, and John was able to express that someone came in and asked him some kind of a question. He didn't even really know what was being asked.
Right.
And now they're asking
Right.
him, "Do you want to go home? Do you, they're they're kind of prompting him. I'm a little concerned that they may suddenly say that he's able to make decisions, and they transfer him to a bad long-term care acute facility and won't be able to get him out of there either.
Chris Buchan in the chat room has another question for you, Lori. I suspect I know the answer to this because I know how worthless the media is at all levels. But it said, have you tried taking your story to local media?
Yes. And as soon as we introduced legal to the situation, they got even nastier. And that's when they put a sitter in the room to observe my visit. And that's when the falsifications of the notes increased. And then when I did another media appearance, within a day or two, the nurse felt a need to call and update me to tell me that he would never come off the vent. He'd live the rest of his life on the vent. And then the next day, the doctor said that same thing in front of John. And I'm sure that was devastating for him to hear.
Yeah. Well, when you said there was a sitter, I mean, because they supposedly hear about how short-staffed they are. So who are they hiring to sit in a room and watch what you're doing?
Probably a random CNA. She arrived just as visiting hours began. They told me that she was there because he had been pulling at his BiPAP mask. Well, he was on the vent at that point. There was no BiPAP, so that was clearly a lie. And I said, well, I'm here by the bedside now. I won't let him touch anything. And they said, oh, no, she's staying. And she stood there, stayed the whole time. And all I did was pray with him and talk into his ear because I didn't feel I wanted to share our conversation with her. But I tried to make light of it. I said, this is Sheila. She's your new best friend. She's going to be observing you and me. And he just rolled his eyes. And he's been aware the whole time.
Wow. Have you heard anything like this from other people that they're basically spying on family members that are actually allowed to visit, Nicole?
This is a first, that part right there. Most hospitals don't have anyone in the rooms with the patients at all.
Yeah.
So a sitter is a unique occurrence. I find the opposite to be the case, that the patients don't see anyone for incredibly long stretches of time. And they continuously complain that they're too short-staffed, which I have no doubt that they are at this point. They've booted 30% of the staff out who won't take the injection.
Right. So they're responsible for it.
When they felt his safety was compromised in the past, they would just put wrist restraints on him. So this was a highly unusual approach. And it would, I mean, I suspect it had everything to do with them planning or orchestrating banning me.
Yeah, well, that's interesting. So your husband has been vented, but not remdesivir. So that's interesting.
We don't think so. But another member of our church was received remdesivir in another Inova hospital. She found out about it when she started to have kidneys issues after she was discharged to home. When she requested her records, they gave it to her without her permission.
Yeah, well, that's what they did with my brother. The doctor said, well, I asked him, and he consented to it. I told him early on, no remdesivir. I told 2 doctors, 2 nurses. Again, I could only do it over the phone. And I told him when I was still able to talk to him, and he couldn't remember the name. He couldn't find anything to write it down there. So again, it's so easy to take. And my brother had all his faculties about him, but a lot of people that were older than him and don't. Imagine how easy it is to do all this stuff to them. There's no family member there to check them. And, they're, what do you, like you said, your husband said they asked him something. He didn't even know what they asked him. He's more cognizant than they would be probably. So it's easy for them to remdesivir, sure. I mean, because again, they're trusting. They're trusting. And that's the worst part. My family, I have a huge family. And I'm the only one except for my son. My son is the only other one I've been able to wake up. Years and years of ranting and raving at corruption. I've been able to wake up one person in my whole family. But so I've been very influential. But because of that, the rest of my family is just thoroughly convinced. Oh, he died. They don't question anything. I said, he went in completely healthy and he's dead in 2 weeks. He had COVID. COVID. And so the COVID thing, that's all they need to hear. And he wasn't vaccinated. And basically, by implication, I'm to blame because, I convinced him not, which I didn't. But so most families are like that. And then if you throw some money their way, well, we're not even going to charge you for the bill. It's an awful tragedy, you died of COVID, but don't worry about your bill. So I think this is all part of the plan here of this, which is really just an insidious, sinister thing that these hospitals are making. They're making $100,000. They made $100,000, I guess, off my brother, if that's what they're doing on average. That's horrible. I don't know what they would make off of your husband. Hopefully he pulls through, and then I guess maybe but they've made 39,000 or 30, whatever it is for the ventilator. And if they can charge him twice, that's 60 or 70,000.
Right, and we have really good insurance, so they're still doing pretty well. But I suspect that's why they keep trying to change his code status, because then they can get that extra bonus if he dies with COVID on his chart, and they make sure they write that in every single note, even when he got the note.
Yeah, well, Chris also wants to know. So then, what is his actual medical status? The reason for him to be on a ventilator of all this time, he said. What is his actual status?
He wasn't able to clear his carbon dioxide once they did all the sedation. He was actually getting ready to discharge to home on the 8th of February. We were going to take him out against medical advice. He had progressed to medium flow. He was at a liter flow that we could handle at home. We had everything set up. And then, unfortunately, he developed a pneumothorax from the BiPAP machine. They had to put an emergency chest tube in. It wasn't large enough. It was a very small 12 French. And then 3 days later, in the middle of the night at 3 a.m., he needed a 26 French, which they put in the ER. And then 2 days later, we have a nosocomial infection. So we had another bacterial infection on top of the one that they never cured. So now he has fibrosis and bilateral lung opacities. But the pattern of opacities in his lungs is that of aspiration pneumonia. Even now, there's a different pattern with COVID pneumonia, and that's not the one he has. He has lower lobe involvement. COVID tends to be the upper lobes. And then he's developed pneumothoraxes and has 2 chest tubes now from the positive pressure machines. So he doesn't do well on them. And
you're not not only not able to see him, but you're not really even able to speak with him at this point because of the trachea. Well, that's awful. And this is what is inexcusable. This is happening because I hope your husband pulls through with all my heart. But what made it so hard for me is that it's kind of hit me, even though I was paying attention, obviously more than most people. I never thought he would die. It just didn't. And then I found out on the 18th that they started giving him remdesivir on the 15th. And it's okay. Now I know why he's in ICU and he seems to be sinking, because and then they stopped giving it to him, but he died on the 20th. It was too late. But I couldn't see him, and I couldn't really talk to him either because he was on a BPAP machine as well, and he was trying to take it off and everything too, the same kind of thing. And he couldn't hear me when I call him the phone because of the machines, and so I had no communication with him. So basically, in 2 weeks, you go from communicating fine, everything, and then dead. And it's horrible because you can't reconcile that because you really didn't get any closure because you don't know what's going on. And plus, you suspect what's going on here. In your case, I hope that you're at least able to start contacting him again because that's awful because you don't know what's been going on for however long it's been since you've been able to talk to him. You're just having to take the words of the doctors and nurses, right? You don't know they could be doing anything for all you know.
I don't necessarily know what they're giving. I do know that all of this damage and the difficulties gotten in, and the reason he's on a vent is because they refuse to do anything but the COVID protocol that we would allow. They would not treat for aspiration pneumonia. And so now we have damage to recover from, and his body's been decimated, just decimated. He doesn't look anything like he used to. Doesn't look anything like he did the day I sent him in.
58 pounds. Yeah, that's just, and again, people had asked themselves, again, what is going on in these hospitals? Okay, so my brother, there are no question in my mind, if he had never called an ambulance, he'd be alive and well today. There's not even 1/10, 1/1,000,000%. No question he would be alive. The hospital killed him with their protocol. the case of your husband, he's lost 58 pounds. So even if he survives, he's going to be a completely different person. They're telling you he's got to be on a ventilator forever. And again, they talk about their cutting edge technology and how great they are, and they're just not. They're not there. I maintain they're killing a lot more people, they're harming a lot more people than they're helping. Now, I hope it's not in the case with your husband, but what have you had anybody? Have you talked to anyone else that maybe has experience from this particular hospital, or have you talked to other people other than me on the show and Stu Peters and whoever else you've talked to from Nicole? Have you had other people? Like, are there support groups that maybe we could form that are dealing with this? Have you talked to others with similar experiences?
I haven't talked to others with similar experiences, except the people that were in different ANOVA hospitals and what they went through. But I did early on talk to our emergency medicine physician who was going to help us when I brought him home. And she looked at all of his markers. She looked at the portal and she said, he absolutely has an infection that they're not treating. But then they've used, they may not have used remdesivir. We may not know for sure, but they've used other things on him that he has not responded well to. Expensive sedatives, benzodiazepines. They've mixed drugs that are never advisable to mix. The one nurse that has falsified the record's been pushing like crazy for morphine, which depresses respirations. That's why he got back on the vent the second time, and I'm sure they got quite the bonus for that, but they caused that. He did well the first day. He was only on the vent 6 days, then he did well, and then he couldn't clear the carbon dioxide again. They also put him on a drug to diurese some of the fluid, and that drug caused complete hearing loss in the left ear, partial hearing loss in the right. It's a major side effect of the drug. I called 4 times and I said, there's been a change. I know his acuity. You have to choose something else. I understand why you're not using Lasix. And all I got from them was, well, he hears us. Well, have you actually talked into each of his ears? Do you know what his acuity normally is? No, they don't. But every time I've asked for something, I've been dismissed.
That's awful. Now, the people you've talked to, and again, I have a vested interest in ANOVA. I worked for them my entire adult life until they fired me 4 years ago for helping out a handicapped coworker, and I could do nothing about it. So, your inability to get a lawyer doesn't surprise me at all, because I had no luck either. Right to work state. How many people have you talked to that had? So ANOVA, I guess, is from what Nicole says, I guess it's has a particularly bad reputation. How many people have you talked to that have gone through the same kind of things?
I've only talked to 2 others. One did not have a negative experience at another ANOVA hospital, where there's actually 3 decent doctors over at Lansdowne that they ended up having, and so they did okay. They were out within a week. And the other person that they snuck remdesivir in ended up having to fire the pulmonologist who was putting it in the IV and not telling her. But that's my experience with the Virginia hospital system. We're not from around here. We didn't know where to go, and we didn't really know how bad it was going to be. We didn't expect it to go well. We never expected this.
Absolutely.
Neither of us.
No, I can't, certainly not. And I can, again, I tell you, as somebody who has been talking, and I'm doing it a lot more now because I have a personal stake in it with my brother, but I was talking about these things. I mean, I talked to Dr. Andrew Kaufman, I talked to Roger Hodgkinson, Scott Jensen, Sherry Tenpenny, all the people this early on. So we knew it was going on. And I told my brother about it. But it was going in one ear and out the other. He was easily confused, and he obviously didn't remember anything. So it's really hurtful that still, no matter what, even though I tried to inform him, this still happens. So just imagine all the people that don't have family members that are knowledgeable about this. They're going in, they're trusting everything. What your husband's going through now, the average person probably, now they might not have been banned from the campus and with the rest, but the average person would probably be just kind of thinking this is a horrible tragedy, and it's terrible what's happened to me, and praying and hoping and everything. They wouldn't be knowing that they're doing the wrong thing. They're not treating this, they're treating that. This is the problem, isn't it, Nicole, that there's so many people that still have trust in this medical industrial complex. I mean, how many, you shouldn't have trusted them when you knew they were the 3rd leading cause of death in America. I used to tell people, ever go to the hospital, but never go for COVID because those protocols are killing people.
So that is the problem, is we've been conditioned that we have a number one healthcare system in the world. And if we have to go to the hospital, that we're going to find that they are acting in our best interest. It's shock and awe to the system for every single family and patient that I've helped. It has been a shock and awe to the system when they get there and find out that the hospital is actually not working toward their good. Unfortunately, in almost every single incidence, it is when the hospital cuts off the patient's food and fluid that the family becomes aware that there's a problem. Every intake the foundation does, we go through what early interventions, if any, did they get before they came in. Most of the time, those early treatments are incomplete. The number one thing the patients are missing is inhaled budesonide. But the families themselves go to the hospital with the patients in the expectation that the staff are going to look out for their good. By the time they realize they're not, it's typically too late to get them out. The foundation's first effort will always be a medical rescue. Whenever we're successful, we save the patient's life. We have a hard time rescuing the patients once they get to intensive care because their oxygen demands are too high.
Right.
But if we can catch them early enough and get them home, we get them on healthy, COVID literate treatment plans and they recover. But unfortunately, the families don't realize there's malfeasance involved until it's too late for a rescue.
And even then they don't want to acknowledge it. And especially when you said, if what I think is true, that they're forgiving bills, is they're forgiving significant money that, most people don't realize when somebody dies, they're still going to hound you, even though they failed miserably. They died under their care. They still want you to pay every penny, even though you have insurance. Like Lori said, she had good insurance. I have good insurance, but you still have copays and you still have money that you have to pay, supposedly. Most people, again, they're gonna think that's a godsend. Well, we lost Uncle Bill, but at least we're not going to have to pay this $10,000. So they'll think of the hospital as kind of a magnanimous place. I think you're going to see more and more of that, and they probably they're figuring, well, we're going to do this because we're making so much money ourselves. We're getting so much money out of this. This is a huge money making operation. But I'm wondering, Nicole, how many you said you rescued? How many people did you rescue? I would have loved to have rescued my brother. I don't know how I would have done it though, because they didn't allow visitors and he was in no position. I mean, how would you even go about doing that?
So in the case of a medical rescue, if we can get to the patient and the family at a point where the patient can still be treated at home on home oxygen, we will contract with healthcare professionals that can treat the patient at home. We'll utilize an attorney and COVID literate physicians that are willing to take on the care plan and write the orders for the home oxygen, and then essentially break the patient out AMA with the use of an attorney and advanced life support ambulance to bring the patient home against medical advice and treat them at home. We have a couple different methods that we can use for that. It ends up being the same thing. We have to try to reduce liability for the hospital while getting the patient out. It has to be done very quickly. Really, the best place to do it is from the ER, where the patients most of the time are on low enough oxygen that it's the matter of getting a oxygen concentrator and a nasal cannula. We can turn them around very quickly if we can get them home. The general public is not aware of just how much we really can do at home. We can get EKGs at home and chest x-rays. We can do echocardiograms at home. We can do IV fluids at home. We can do IV steroids and IV antibiotics at home. We really can do a lot in the home environment, including oxygen up to roughly 20 to 40 liters per minute, depending on the concentration of oxygen they need. And we can get them healed up. Most of the time, when we get the patients on inhaled budesonide every 2 hours, we see their oxygen demands come down very quickly. But this is a little known fact among the general public that just the use of inhaled budesonide, which name brand that's called Pulmicort, if you get diagnosed with COVID and you start on inhaled budesonide and aspirin and some multivitamins, you reduce your risk of hospitalization by 90% just by doing that without ever taking hydroxychloroquine or ivermectin. So that's a very big difference that we can make right away if we can get the patient out of the hospital. Unfortunately, in the hospitals won't even give inhaled budesonide. Even when you put all the research in front of their faces, they still insist that this is not a evidence-based treatment.
Yeah, well,
Now,
that's the problem.
Nicole was helping us. We were almost at that point. John got to a point
Mhm.
where we could support him with high flow at home. He had gotten budesonide prior to the hospital. We did all of the things that she was explaining, plus hydroxychloroquine and the ivermectin, which is why he cleared COVID so quickly. But then they just refused to think it was anything but COVID. And we had all the discharge plans lined up. But then he ended up with a chest tube. And after the chest tubes, he could no longer clear the carbon dioxide. And he still has those chest tubes, and he's still struggling. But we were so close. Nicole has been a rock, and we were just close.
Sounds good. Sounds like a great research. Now, I assume you might have mentioned. I assume your husband's not vaccinated. You're not vaccinated.
No. We I have a vaccine injured son, and we have definitely been well educated. I read all the white papers for the past 18 months. We were well educated about the dangers of the vaccine, so-called vaccine.
Good. I'd be interested to you because my and maybe Nicole can answer this. Because again, I don't know. It's my brother, but my impression is no matter what you go in the hospital for these days, probably the first question anybody asks you, the first person to hit you in the ER, whatever, the first thing they ask is, are you vaccinated? Am I wrong in assuming that?
Well,
I
don't know. I can't speak to that. I don't have actual tangible data in front of me to speak to that. But what I can tell you is when you hit the hospital doors, the first thing they want to do is give you a COVID test. And with such a high false positive rate, whether you're vaccinated or not, you're likely to come out quote unquote positive, in which case they immediately move to the line, you're going to die if you don't take remdesivir. They're just so conditioned and programmed to this that, it's like the beating drum. So I'm sure that it's very common to ask, are you vaccinated? I actually had to go to an ER recently, and it was not the first thing they asked me if I was vaccinated. That was a big relief to me, but I'm sure that was an outlier, although I don't have actual data in front of me to speak to what percentage it is. I would think it's probably pretty high. So
there's Demon 1800. I was just going to ask that Demon 1800 in the chat. Welcome to the chat room. Says that the Pfizer data release so far is terrifying. What do we know about that? Have you been following that, Nicole?
Yeah, we do follow that at the foundation, and all the data is terrifying. There's new data out regarding the alteration of the DNA. That's terrifying. This is something we've known about. And yeah, the Pfizer data is pretty bad. There's about 15 pages of known adverse events that you have to comb through. These are things they knew were going to happen from taking the shot because they documented and seen it in the early trials. It's shocking and appalling. And I think there's a lot of people that are starting to wake up to the truth. But as I tell everyone, this is, whether you've been vaccinated or not, the issue here is a lack of evidence-based care. If you have COVID, it's a lack of evidence-based care. It doesn't matter whether you've had this shot or not had this shot. I've had families who have quote unquote vaccinated loved ones who get treated exactly the same in the hospital as the unvaxxed. They still get told you're going to die without remdesivir. I just had a patient die a few weeks ago that had gotten all of his shots, and they got him to the ER, and they beat the same drum. You have to take this remdesivir and you're going to need to go on the vent or you're going to die. And guess what? They gave him the remdesivir and he died. And he died pretty quickly too. It was tragic. So this is a problem with this is a lack of informed consent and a lack of the medical professionals being educated about evidence-based care.
Absolutely. And I think that there's so many, because people tell me all the time, it's like, well, so are you saying there's a conspiracy so that, I mean, there are nurses in my family. You think we want to kill? No, I don't think you're purposely trying to kill patients, but you're following the protocol. And the protocol is killing them, and you're trusting in it. I mean, most nurses, some of them, we know that they've had some renegade nurses. I interviewed one last week, but there's most of them they trust in their education, they trust in the system, so they think they know best. This is a protocol. COVID's a horrible thing. We're doing the best we can. What are either one of you? What are your impressions of that?
Well, I think I'd like to say that there's a level of cognitive dissonance that happens among the general medical staff. They're replete, they're drained after 2 years, but that doesn't mean that they're exonerated from criminal liability. They're responsible.
Right.
They took oaths to do no harm. Their job is to practice the art and the science of medicine, and that means that they're responsible to ask the questions. That's the scientific process, right? We're not supposed to just mindlessly accept what someone else tells us. We're supposed to ask the questions, do the research, and grow our understanding. They don't do that. They don't critically think. And it's no different than the original Nuremberg trials where the medical staff said, well, we were just following orders. Well, they were criminally liable as well.
Well, I should, and Lori had mentioned that in her case, and so obviously there are people that are not just naively trusting the system. I'm interested more about the nurse that was caught altering the charts. I mean, falsifying data. That goes beyond that, because you have to know, if you're trusting the system and you just think, okay, we're doing the best. Well, what are you falsifying data for? What was the story behind that? Why do you think she did that? And do you think she was ordered to by someone?
I think that legal got involved. We were told at one point the hospital lawyered up, and the CEO really didn't want me asking questions. And so I do believe it was orchestrated, and this particular nurse was always a little bit nasty, and I don't think she had any trouble putting those lies down. But we also had the doctor early on. I had to report him to risk management because he would write that he went in and listened to my husband's lungs. He'd describe what he heard. And then my husband would say he never came into the room. And that was also falsifying the medical record. So I reported it. So they really were not happy with me advocating for my husband. And John was able to advocate for himself. That's why he's still with us 58 days later. He was able to self-advocate. And he and I are on the same page regarding the vaccine, the whole COVID crisis. We've been well informed all the way along. We know the distribution studies, and we know that if he had been vaccinated, his immune system would have gone down. He wouldn't be with us today. He wouldn't have had what he has to fight, which is very little, but he would have had less.
It's absolutely true. And I was just going to say that the one thing that I've seen consistently with every family is that if the patient or the family has the will to fight and they actually have become informed, the staff do not know what to do. They literally do not know what to do with an informed patient or family member. I just did a rescue up in Baltimore with a very informed patient who fell into the category of not realizing the hospital might mean him harm, but he was a strong advocate for himself. It was so abrasive to the medical staff. We got him a physician who did a telehealth visit while he was still in the hospital. And that was so abrasive, having that strong physician and a strong patient, that they made my medical rescue easy, because they came in and said, we're kicking you out of here. We don't want you in our hospital.
Sure,
Because
sure.
they did not know what to do. They still told him, you're going to die without this, but he's still alive and doing quite well today. But they don't know what
Good.
to do when you push back against them. So,
No, they don't. And what I was saying, I think there's so many people are because I don't want people to think that I think all the nurses and all the doctors are engaged in some giant conspiracy. Although I certainly see conspiracies everywhere, but there are when you have people like that, or I don't know if you remember a few years ago, and I think there's been one, maybe two of these doctors that came out and admitted and were convicted of this. One guy had been doing it for like 20 years, 30 years of. He admitted to giving out fake cancer diagnoses to patients for like, again, he made a career out of this. That people didn't have cancer and they treated them with chemo and, killed them a lot of the time. So who knows how many others didn't get caught? So I have a very low opinion of the medical profession in general. Again, having seen the sausage being made there, and I know that a lot of nurses are uncaring, unfortunately. And one Lori described that ended up changing the charts was already kind of had it. Maybe she was predisposed to do that. Maybe they think they're doing it for the, like cops planting evidence or something. But it's awful to hear that when somebody's doing something willfully wrong. It's one thing to suspect, they're doing it, but if they're caught doing it, that's just awful. So if you ever get a lawyer, I guess that would be one of the main things you're looking at. Lori?
Right, right. And basically, we need a lawyer now to fight the chart falsification, but we may also need someone to actually get him out. Now, all of a sudden, since we've been going to the media, I'm getting calls about discharge planning. He's not stable. He has chest tube. He's varying and spiking temps and all kinds of things, but all of a sudden they're talking discharge. So I think they don't want to deal with us anymore.
Well, what media have you gotten any interest from? I'm shocked if you had any interest from the media, but has any media been interested in actually reporting your story?
Actually, I was on WMAL and I was on Stu Peters. I've contacted some other really great sources,
Right.
but I haven't heard back. So that's about it so
You were
far.
on you were on WMAL. I'm amazed because I couldn't get the interest of I couldn't get the Fairfax Times or whatever connection. I couldn't get these people. They were scared to do something. It was very big. Well, that's good for you. I mean, certainly hope that you can do something about it. It's got to be. Now, what about the rest of your family, Lori, in terms, and I'll ask you that too, Nicole, because I'm looked at as a black sheep in my family, and they think I'm nuts. They thought I was nuts before, and they really think I'm crazy now since I'm saying my brother was murdered because, oh my God, you're insane. How does your extended family support your criticism of the hospital, or do you have some blind devotees of the medical industrial complex? And Nicole, you can answer after that. What does your family think of what you're doing, and are they on board with it? You first, Lori.
My husband's daughters. This was a second marriage, so my husband's daughters don't necessarily support my view of the hospital and have actually kind of enjoined with the staff, which has been a bit of a problem. The one even showed an inappropriate note that John had. It was part of a larger conversation, but she showed it during a Zoom meeting where we were learning about the trach. Now, my daughter is unvaccinated. We've been through the vaccine injury with her brother, and so my children are well informed and understand where I'm coming from, understand the vax issue. And then we have an extended church family. They are all behind us. They understand what we're going through, and they are all of like mind. They're the ones that have been helping me connect to different media sources, and they're the ones that helped me connect to Nicole, which has been wonderful.
Oh, that's great. You have that support staff. How about you, Nicole? Are you looked at as the kooky lady that should have just kept a good job as a nurse and instead of going down these rabbit holes?
I am abundantly blessed to have a family that loves and supports me, recognizes that I am a diligent seeker of truth. And my mom's over here in the background listening to our interview right now. I just cannot tell you what fabulous support my family has been, both in the role that I'm serving with the foundation, but also in just understanding the truth of what's really going on with COVID and these injections. Um, my mom and dad, my husband, my children, none of us are vaccinated. My in-laws did get the first two, but now really understand what's going on. We'll never get more. And I think I'm just a very blessed woman.
You are. I mean, I have a huge extended family, and the only ones, me and my children, are the only ones that aren't vaccinated. So, last year there was a niece that got married. We couldn't go to the wedding. Vaccinated only. So I said, okay, I'm sorry. I hate to miss her wedding, but I'm not getting vaccinated. There's a reason why. It's based on knowledge. And so, and I have a huge, again, I don't know one other person, and I have so many cousins, and it's amazing. But so you are blessed.
Yeah.
I hear that for the most part with people that we're kind of outcast, and people think we're kooky, unless they maybe have a personal experience. But a lot of the people, when you deal with people that have had these experiences in the hospital, do you have as many that were vaccinated and they trusted in the system, and then their eyes were open when they experienced what they experienced?
Well, that's a challenging question because I've had only a handful of patients and or family who have been vaccinated. Almost all of the families or patients I've served have been unvaccinated, which means there's been a level of knowledge and awareness. I feel like what I've observed nationally is that there is a gap in knowledge. So amongst the majority of those that I've served, they have good knowledge and understanding about I should not take this shot. My loved one should not take this shot. But they haven't been as well prepared or informed about how to access COVID literate care and be prepared in advance so that they have the tools in their toolbox to fight when they got COVID. So I would have to say that, that's been what my experience has been, and that's been at the heart of the foundation's efforts with regard to COVID in support of Dr. McCullough, who sits on our medical directory board. We've tried to get the public informed about evidence-based early care to try to stop the hospitalizations from happening.
Absolutely. And 24-hour jukebox, thanks for being here. A chat on the Jimmy Dore Show would be wonders. People tell me about Jimmy Dore forever. His producer has one of my books, and I don't know why we can't hook it up. Same thing with Tucker Carlson. They have the same book, and we've communicated. My publicist has communicated with him. Can't seem to make it, and that's what the word. I'm thinking that Tucker has done some really good work. He's the only one in the mainstream media that has done this work. So I'm wondering if you guys contacted you, Nicole, or Lori. It's possible he hasn't done as much as far as the hospital killing people thing. It's more like he's had vaccine injured people on and kind of questioning it. I'm wondering if you have thought about contacting his.
We have reached out. We haven't heard back. We've reached out to them.
Okay.
We've reached out to the high wire, all of the things that we normally listen to, and we listen to the same doctors. But we followed the protocols. We have a very good integrative physician up in Pennsylvania. He had us pre-set up with the proper antibiotics. We got a large amount of ivermectin when my husband was in India in November because it's over the counter there. We had the other drugs in the house. We did everything according to the Frontline Critical Care Alliance protocol, Dr. Zelenko, which is why, we were really pretty obviously dealing with an aspiration pneumonia.
Exactly. Which is a separate issue, but they still made it the same thing, which is just a tragedy.
They made it COVID. And
Yeah.
I even called the lab to find out, because I knew that as soon as they found out he was unvaccinated, they were going to run the PCR tests at a higher cycle threshold because the FDA has told them to do that. I asked for the cycle threshold. I asked for a copy of everything they sequenced. The person on the phone was about to give it to me. She went away. She came back and she said, "Oh, only the doctor can have that information." All of a sudden.
Yeah. Well, again, patient information. You should have the right to have that. And well, you're their biggest nightmare. If you know about the thresholds and that's, yeah, they what? We got one who can see here. Um,
Well, they
Chris
also
Buchan.
sequenced more. I wanted to see what else they sequenced because they only came back, even with all of that, it still only came back presumed positive. They couldn't even
Yeah.
say it was positive.
And that's one of the big. I mean, I had John Rappaport on my show when this first started, in probably March or April 2020, and he was right on that from the beginning. And he's done some great work. No more fake news.com. He talked about at the time, they're including presumed cases. If you look at the CDC reports, the weekly reports they used to send out, I published all this on social media. You'll see every one of them has a little asterisk, a disclaimer. It says, note, includes presumed cases. So they're including, that means untested or unproven cases, so it makes a mockery of their numbers. I mean, what kind of science is that? Chris Buchan talks about, you mentioned Del Bigtree on there. I have interviewed Del Bigtree. I can't get to RFK Jr., who's his partner, but Del Bigtree was on my show. So I have talked to him. I've talked to all the people pretty much, except for RFK involved in this. But I want to, because, we have, I had a little over half hour left. Nicole, I want to, and I don't hope you don't mind listening to this, Laura. You might know about it, but I was very impressed with that other that report I saw where you were talking about your child being bullied. I said you have to email me your address because I'm going to get you a copy of Bullyocracy that I wrote about bullying in the schools. Because you'd obviously be interested in that. Talk about that, because that experience again, it's part of the systemic corruption, legal system, the medical system, and the school system. Obviously, I mean, obviously, we're seeing the school systems everywhere. The teachers on TikTok, and you see these monsters that are teaching your children. But tell us about that experience where you had to end up homeschooling your kids.
Well, actually, I didn't have, I didn't have to homeschool them because I was able to move them to a private school. But these two actually do go very hand in hand. So, a number of years back, my fifth grade daughter was sexually assaulted by a peer multiple times, and my fourth grade son was bullied to the point of becoming suicidal by a group of students in the same elementary school. My husband and I fought relentlessly, started a grassroots movement that became a national movement. We fought our way up through the ranks all the way to the U.S. Secretary of Education, Secretary DeVos at the time, where my daughter and I were invited to go testify on behalf of 50 million students about school violence. What we actually uncovered over that course of time is corruption at the highest level of the U.S. Department of Education. That basically the U.S. ED strong-armed all the school districts in the country by saying, hey, listen, we think you disproportionately discipline students of color and disabled students. So we're going to send the Office of Civil Rights out after you if you don't stop disciplining, which created chaos in the classroom and is why my daughter got sexually assaulted and my son ended up with a death note on his chest, because it was discriminatory to discipline the offending students. It took away their academic rights. Over the course of that study, and I would encourage all of your listeners to go download a free copy of this book, we started researching what was really going on. Charlotte Iserbyt wrote a book called The Deliberate Dumbing Down of America. And that is precisely and exactly why we have the problem in medicine that we do today. Over the last 100 years or so, the communists, and she has documented all of this with the actual documents from the U.S. Department of Ed. The communists realized they could never take us down by way of arms because of our Second Amendment rights. So they decided to undo us through our academics and our media. And they've effectively, we can't think our way of a wet paper box. We literally are deconditioned from thinking, and we've been programmed to respond to what we hear on the TV. It is compelling and shocking. But in that course, yes, we advocated all the way up to meet Secretary DeVos. She's actually a wonderful lady. Even to this day, I still sit on a national reform education reform group with AEI. And, every effort is made to try to make changes in the classroom. Unfortunately, I got to tell you, the education system is too far gone and it needs to be collapsed. The path back to freedom in our country is actually through education, but it would resolve a clearinghouse of corruption that you just can't even fathom. It's amazing how corrupt our education system is.
Absolutely. Well, you'll be amazed at some of the stories in Billy accuracy, and that was before a lot of this has been revealed. Once the lockdown started, the mass mandates, and the school board members, you see these little petty tyrants. And Lori and I are very close to the epicenter of this movement to try to reform the school boards. Loudoun County, Virginia. I used to work in. I live in Fairfax County, and it's where Fair Oaks is. But you're seeing they're trying their hardest. But what happens is they go to the meetings, you'll have one mother that'll get up there and be great, and the rest of the people behind her just sit there. And they don't, if they just were in a unified stance with up, but we're not doing it. First of all, it's 24-hour jukebox. Thank you for being here. You're in Scotland. Wow, it's 1 a.m. here in Scotland. I love the reach of these internet shows. And people say, nice to know that someone's up at 1 a.m. listening to me in Scotland. Hopefully we're keeping you entertained and keeping you awake. But so that's the problem, is that but you're seeing the same kind of disconnect, the same mindset. You're saying they're not thinking, and that's not true. People trust. Why would you? I don't know why you would trust any part of our corrupt establishment at this point, but how do you trust the school system if they're dealing with it? All you got to do is look at some of the school board meetings and look at the way that people act. Did you see the woman that got on there and showed the picture of the school board president that wasn't wearing a mask on stage, and she went nuts and walked. You were caught with your pants or your mask down. So, sorry. But when you see those kind of petty tyrants, we know, obviously, Lori and so many others know what the medical system is like and how corrupt that is. We know the legal system when you're having trouble getting a lawyer. And that's so the only way we can do this is to come together. That's why I said, I like to say we're sending more tiny ripples of hope. So I know you're doing that as well. But just looking at that report, so you encountered a lot of opposition from the schools when you started talking about that, right? They didn't say, "Oh, well, yeah, we don't want somebody being sexually assaulted on." Well, they didn't do that. Instead, they tried to.
We did everything to the point where I literally had to march into the principal's office with my daughter and say, "You're conditioning my daughter to tolerate, sexual aggression by leaving her sit in a math class with a sexual offender who is a peer." And I was told that I was, I was out of line because that student had academic rights that superseded my daughter's physical safety. But what flowed out of that was just uncovering a trash heap of suppressed data and corruption that we just can't fathom could be possible in the public school system. They use those school boards to funnel money like you would not believe by all these tech contracts. It's happening all over the country, and they're literally bankrupting the school systems by draining the money out of all the counties through these tech contracts and CRTs that are, it's absolute madness. And people do not understand how this whole thing works. The U.S. Department of Education funnels money down to the states through supplying the states with monies for grants to the counties. And then the counties get these monies by agreeing to certain stipulations, which without doubt include not disciplining students, suppressing data, and pushing the CRT and the LGBTQXYZ agenda. And there's nothing that you can do about it. So you can go to your state legislator and pound your head into the wall saying, we don't want CRT in the classroom. It doesn't matter. The schools are just going to rebrand it under another name and do the same thing because they're going to get that money. The only way to fix it is to withdraw the kids.
Well, speaking of Loudoun County, I'm sure you probably heard the case. It's very similar to what your daughter experienced recently here, where we had a transgender. Yeah, I mean, and look, they arrested the dad at the school board meeting. It's ridiculous.
Oh yeah, and as we petitioned our county and state, You schools think you're above the law, that you can suppress criminal activity by labeling it a right to education, but they sure enough have. And our nation is in massive trouble because an entire generation of kids is coming up believing that they can't fight against tyranny. Their rights are not going to be represented. And the criminal element of the school systems are left to act out criminally with no consequence. You can't turn that out into the society without major consequences, especially as we continue to defund our police and suppress criminal activity by not holding them accountable. It's a catastrophic nightmare. In all of our advocacy, what we actually most strongly advocated for is a withdrawal of students of at least 10 to 15%. If every county experienced a 10% to 15% withdrawal of students, you'd crash the education system the next year because their funding is based on student enrollment. And they literally would not have enough money to run their schools.
We live in
Lori,
Mountain
what's
County.
yeah, okay, so you're right there in the middle of it. Yeah.
Yeah. For us, we took our kids out and paid for private education.
We have a constitutional freedom class that included some of the parents that were experiencing some of the issues within the Loudoun County schools. They all attend the school board meetings. The teacher that was suspended, we helped to support. The two young girls who were suspended for not wearing their masks, even after Youngkin said they didn't have to. We won that battle. But the Christian community in Loudoun County is united, and we are fighting the tyranny, the lies, the deception. In fact, our church shares a wall with the Loudoun County not school board, but offices. And we just kind of put our hands on the wall and pray, and we're trying to make tremendous change for the sake of the children.
Yeah. It's so sad for the
Absolutely.
kids.
No, it really is. So how you have children in Loudoun? How many children do you have in Loudoun County schools, Lori?
Oh, my youngest daughter is now being deceived in college. My other children are out of school.
Okay, being deceived. That's a good way to put it. That's the problem. People tell me, and I want to thank you, Prairie Fire, for the kind words, and thanks for listening to me on Jeff Rentz. Well, I go there every Monday as well. I'm on there, and it's so hard to, especially when you're dealing with what you're dealing now, Lori. What I've dealt with my brother personally, and just looking at the world, you're already kind of involved in this because you're going to the school board meetings, you're seeing the crazy stuff that's going on. Nicole, you've dealt with it personally too, with your own children. How do you? I mean, you have your faith, Lori. But is there anything beyond our faith? Like I tell people now, look, political solutions are gone for me. I don't think America is so corrupt from the top to the bottom. It's so rotten. It would take a supernatural force. It would take a God to clean it up. I don't think we can do it at this point. It's this when you have school board members that have the attitudes they have at that level. If we can't get that cleaned up, what can we do?
Get on our knees and repent.
Yes. That's why the Christian community is coming together to form alternatives to pull those kids out, because we know the ramifications of reducing the student population. Many of them are already homeschooled, but some of them are just fighting in a different way. And one of the largest churches in Loudoun County just announced that they're starting a huge Christian school that's going to pull from the public school. That'll be good.
So, and I'll share this with you, because I think nothing could speak more powerfully than this. When we took our kids out and put them in a small, private, classical school, Christian school, they immediately started getting taught the Constitution and the Bill of Rights. Now, just a week ago, as I was teaching my son about what's happening with Ukraine and Russia, here's what my 8th grade son looked at me and said. He's like, oh, so we're going to go into hyperinflation and we're going to lose our food supply. And I said, yeah. He goes, that's what happens in war, Mom. He had been taught. He's educated. He can think his way out of a wet paper box. And that's in just a couple of years of education that actually taught them actual history. And that's the difference. And you're right, Lori. They just have to come out. They can't be in there. They have to come out. They have to
I
be loved and
homeschooled my
cared
middle
for.
son, and he knows the Constitution. He knows the Bill of Rights. His knowledge of history is brilliant, and he has the same insight into what is happening in the world. And
Yep.
he's also very disturbed at what's happening in the world because he has special needs and he doesn't know how to handle all of those emotions. But
Yeah.
he understands because
Yeah.
of the education he got.
Yep.
You mentioned that he was vaccine damaged. Is he someone who you suspect is part of the whole
He reacted
vaccines
to
and
his third DPT. He ended up with
yeah,
an
yeah,
encephalopathy one night as an infant after the third DPT, screamed all night,
yeah.
captured it on a lullaby tape. The most odd, ear-piercing scream you've ever want to hear from an infant. And then we've been fighting the past 23, 25 years or so to get him back. And he's done well, but it's been a long, hard battle.
Mm-hmm.
Absolutely. So, but again, the same medical community, the same scientific community that is lying about vaccines, lying about this entire COVID narrative, and it is subjecting your husband, people like your husband, to these
Yes.
hideous protocols that are killing so many people. They're just you can't. They're implacable about this. They will not. You're one of those nutty. My friend Naomi Wolf, who wrote the foreword to one of my books, and she's just still getting blasted. She wants, New York Times bestseller, big feminist, wrote The Beauty Myth. They loved her in the New York Times, but now she's an anti-vax expert. They hate her. I was looking online the other day. They were having a discussion on. I said, "Oh, this is." All because she questions this. She's not even that radical about it, but she questions it, and they will allow no dissent. So when you talk about that, same thing with Robert F. Kennedy Jr., who I think is the most courageous guy out there in the public eye right now for doing what he's doing. But he was one of the first ones to talk up about the obvious link between vaccines and autism. But I'm sure, as you discovered, trying to get anywhere on this, is that the entire medical community thinks you're kooky if you even hint at that.
Absolutely. We've been following Barbara Loe Fisher and Kennedy for years. So I've been in this battle for a long time. So I'm not new to it with my husband. This has just been more devastating and frightening. But he is, you mentioned God having the only power. And after 58 days, if he didn't have that spirit, if he didn't have the Holy Spirit sustaining him, I don't think we'd be still talking about him.
That's right. It's the Lord. It's the Lord.
So we're really depending on Jehovah Rapha right now, not just for John, but also for my son and some things that I'm experiencing because of the stress. But we have a strong faith, and that is probably the only thing that's sustaining us.
You definitely need your faith at this time, boy. If you, it's sometimes you think that's all you have, because it's just everywhere you look. I said I try to come up with a silver lining or some kind of hint of optimism. I don't know. I mean, now of course your husband's still stuck in this, and I've lost my brother to it. But apparently, COVID's gone now. Now that World War III is here, the mass mandates. Yeah. Yes.
Hey, Don. In the end,
yes,
God wins.
Yes.
Right.
Yes.
That's what we have. That's what we have to keep in mind. Exactly.
He already got the victory at the cross.
Mm-hmm. And he has all the authority, not the one in this world. He does.
Amen.
Yeah, and that's how John and I live, and that's what's sustaining us, and especially him.
Absolutely. Well, I'm amazed that both of you, like me, obviously the world I come from, but both of you have been through your battles already with this corrupt system. In the case of Nicole, you've had your son was bullied as well. Let's talk about that. Your daughter was molested, and Lori, obviously your son was damaged by this vaccine system. But Nicole, talk about your son just real quick. We have a little time left as far as he was bullied, and if it follows the patterns that I found. I talked to several parents whose kids had killed themselves as young as elementary school level, which you never used to hear of.
Yeah.
And the schools always disclaim responsibility. Try to blame the victim. They will do that too. They'll actually try to blame the kid afterwards.
Yeah. They blamed him. Yeah, he was in the 4th grade, and it started with an individual student and then became a group of students. They threw him in the mud. They punched him in the face. They did all the things that are horrific. And we taught our son kung fu with a sifu, a world level master who happened to be my boss at the time. And we let the school know when they kept not doing anything, that he was getting trained to protect himself, not to aggress, but if they threw him in the mud or punched him in the face again, we were teaching him how he could protect himself from harm. And at that point, they actually told me if my son defended himself, he'd be suspended from school for acting out violently. And we said, very well, if our son defends himself and you suspend him from school, he'll have a 3-day ice cream and movie party. Thank you.
And that's the pattern. And you will see in my book that they don't do anything about the bullying. But once the victim, if the victim fights back, suddenly they notice it and they go after it.
They told me there was no reason for him to ever need to fight back because there were always people that he could go to. And I said, well, if that's the case and there's always people that are watching and he could go to, then tell me how he came home with soaking wet, muddy clothes because he was thrown into a mud pit. How did that happen? It was horrible. Your viewers can, we had a lot of coverage across all that time frame because we had made our way up to the U.S. Secretary of Education. The Daily Signal and a number of other media sources did some reporting on us. Underreported, the Daily Signal, I think the title is Their Son Was Bullied. It's about an 8-minute documentary that did go viral. I can't remember how many million of views it was, but we had good people all the way as far as Anchorage, no, not Anchorage, Antarctica, right, to let us know that we were bad parents for teaching our kid to defend himself.
Yeah.
So
well, that's
my son is much better today, but they sent out the bullhounds, but it doesn't matter. We did what we were supposed to do. But at his worst point, we did find him sitting in the dark with a suicide note on his chest in the 4th grade.
Yeah.
The students told him his life was worthless and to kill himself.
Yeah. 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 It's shameful what's it, and there's so many stories like that, young kids. And then with the internet, the cyberbullying is even worse because they will do what you said there. They have the power to go on Facebook or Instagram or Twitter or any of them and say, go ahead and kill yourself. Nobody loves you anyhow. Go ahead, I dare you. It's happened over and over again. And even with the evidence of the kids doing that, the schools and the anti-bullying experts, that's the worst part. They have the anti-bullying experts who I haven't found one of them yet. I communicated with several of them who sticks up for the victims. They're all on the side of the bullies. The system is just rotten to the core.
It's rotten to the core. And our kids think we're just awful parents, but we won't allow them to have any of that social media. They don't understand it right now. God willing, they will. If we walk on this earth long enough for them to become adults, they'll understand it then. But we don't let them have any of that technology because of that very thing. Predators and cyberbullying.
Yeah, it's absolutely there's so many things now that just and I'm glad my kids were young, little today. I would be in a lot of viral videos. I'm sure. First of all, I'm right in the center of this board stuff, so you would see me pictures of me probably being carted away or something. But conspiracy theorist dad, of course they would me. Oh, look at this guy. Of course, what do you expect them to do? But
if I were that parent in Loudoun County, I'd have been taken out in handcuffs too.
Yeah, I mean, God, his daughter is raped in the bathroom, and they cover it up.
They left him with no recourse. They left him with no recourse, and I can tell you because we spent a lot of time with Secretary DeVos in her private chamber with some other families from across the country. There's some heinous and horrific things going on in these schools that are covered up, and the parents are left with no recourse. it makes them go crazy because they can't defend their children or protect their children. It's absolutely appalling.
Absolutely. I mean, that's when I'm really surprised that you haven't had more people getting desperate and going crazy. And I'm surprised I haven't seen somebody bring a gun in really to one of these school boards because the level of frustration is so deep when you can't get anyone to respond to you and you have them acting like that and using police power and everything. It's just a horrible situation, and and obviously you're experiencing it in a different way now. But so how Nicole, your organization, tell us again about your organization, and is it growing? Do you sense that this is
Yes.
something where maybe you could start chapters across the country or whatever?
Truth for Health Foundation is a 501c3 public charity. It is a national organization. We function internationally as well. Our medical board, Dr. Michael Yeadon is on our medical board, Dr. Malone, Dr. Peter McCullough. Um, we all work together, and the foundation's goals are medical freedoms, fighting global tyranny, and education. We have a fair number of initiatives from medical ministry to supporting the military, to safe and evidence-based COVID care and exposure of the vaccine chaos. So we have a number of arms. We do a lot of work, and we live on donations. You're welcome to visit us. We'd love if you would come and see us and support us, glean from us. We try to keep the site loaded with evidence, peer-reviewed evidence, and true science. It's truthforhealth.org. We'd love for you to come check us out. If you have a loved one that needs help, you can go to the COVID strategy team and fill out an intake right online, and I will be right in touch with you. They come right to me and I reach out right away.
Right. Is that how did you, Lori? Did you just heard about them and you contacted them?
Someone from our church family had given me the contact information, and as soon as I hooked up with Nicole, she brought in the attorney. They were extremely helpful. She's helpful from a legal standpoint, but she's also a tremendous source of knowledge, medical knowledge, and emotional support. And we prayed together. She's been a rock for me, and I have needed someone like that. Even though we haven't had any success yet, that doesn't mean that we won't. And I'm walking in faith that we're going to have a breakthrough. But I've been so grateful for Nicole's support and the organization. And the doctor that was willing to follow us in the community is also on their list of doctors who treat COVID on the Truth for Health site. So I'm just grateful for what they do.
Well, that's great. I'm glad you found each other, and so it's wonderful you have your church. You have said your family in the church there, but I'm wondering, like, if you have, because again, my problem is siblings, and things like that, and cousins and all that. Do you have siblings that agree with you on any of this stuff, or do they just kind of think you're out in left field, or do you
We
have
have a very
support
small family. My husband has a larger family, and his one daughter took the vaccine, and then her young baby daughter had issues after that. Someone took his 96-year-old mother to get the Johnson & Johnson shot, and she's been tipping over ever since. And this was a lady who cleaned her gutters and mowed her own grass. So his siblings, some of them are on board, some of them are not. But we don't have much in the way of extended family. Our church family is our family.
Well, it's great you have this work because a lot of people don't. A lot of people are by themselves, and I think I mentioned it earlier, but I think when we're looking at this situation in the overall aspect of 40% increase in the death rate, I'm stressing that every time I talk now because I think that's the biggest story maybe of my lifetime. I mean, if people realize how many deaths. I mean, the death rate has pretty much always stayed the same, but you can see it. Like I've just noticed this year how many celebrities. Celebrities are dropping like flies. I mean, way more than they did in the past. People are dying at a much, and I don't know if it's a lot of it because of the vaccine, There's certainly the ones in the hospital that are like my brother. There's a certain number of them, obviously, and then the suicide rate and the opioid rate is increased dramatically as well. Nicole, are you factoring any of that into this increased death rate? What are you seeing there?
Well, I think that what we found in a lot of the statistics is that some of that has been controlled for, right? The increase in the death rate is driven by non-COVID related things, right? So how we tease out the emotional component from the shot, what we can say is from a science perspective, what's changed, right? You have to ask yourself your question, what's changed over the last year? Well, we've had COVID isolations, and we've had the introduction of a experimental shot that no one gave strong enough consideration for before they went out and took it. What could happen to them?
We know of 5 people who have died within 3 weeks of their shot. A 53-year-old just this week, a 17-year-old in his sleep was an athlete, and one of our friends' grandsons, 20 years old, also died in his sleep post-vaccination.
It's heartbreaking. Yep. It's heartbreaking. And unfortunately, you see the same thing playing out within the hospitals as you do amongst these people. Cognitive dissonance, the facts and evidence are there. It's too emotionally disturbing for them to come into an acceptance of the truth. So they react, right? That's what Dr. Malone talked about. So.
Yeah, absolutely. And, and certainly we see with the heart disease in children now, it's just, you talk about heartbreaking. That's incredible. And they're trying to normalize it again. And I guess it'll be a test to see just how stupid some of these parents are. If they start accepting that you can normalize little kids having heart attacks, you can't possibly communicate with people that are that dumb. But apparently that's what they're trying to do. I've noticed that.
100 years has been spent dumbing down, the deliberate dumbing down of America. I'm telling you, 100 years has been spent dumbing down the people so that they don't critically think. They're already doing it. They're already saying kids have heart attacks too. And it's
exactly. And again, I hate to laugh about it, but it's so stupid because I guess it could have. It was incredibly unlike lightning hitting 5 times in one place or something. I guess maybe you had 1 in a billion that it might happen to, but it's certainly not something that's supposed to happen at all. And now they're normalizing it because of their vaccines. And I just don't know how. This is the most monstrous cover-up of all time. But you can see what Lori's experiencing, what I experienced, what you're hearing about every day, Nicole. It's so all-encompassing, and so many people involved. It's so big. One of the biggest things in the conspiracy world that people tell me all the time, well, someone would have talked. Lots of people have talked. No one's listening. Who do you talk to? That's the problem. And it's such a big deal, and you're demonized because they think, you're a kook.
It's the true definition of a delusion. You cannot argue against a delusion. Way back in the day, I got a degree in clinical psychology, and that's one of the things we learned about in our abnormal psychology studies is you cannot argue against a delusion. Facts and evidence do not change this. If you want to help folks come into awareness, you're going to have to respond to them on the level where they're functioning is in the emotional domain, not in the evidence domain. You have to come alongside them when emotionally they become dissettled and ask the question. That's the only way that we can help these folks out, because facts and evidence are not going to sway them or open up their minds.
No, they're not. Like I said, in my family, I can try to say, he's healthy. He went in the hospital. He's dead in 2 weeks, and it's just all you have to do is say COVID. Well, it's COVID. Like, okay, that's all. You don't need any other explanation. Well, it's COVID. Anything is possible. And he was in the hospital. He was in the best place. Well, you don't know what's really going on in the hospitals, and they're certainly tilling fields now, if they weren't before, and I think they were before. But anyway, so I wanted, Lori, anything else you want to sum up or promote? And then Nicole, anything you give out your links again or whatever you want to promote.
Yeah.
Well, basically, they are talking about discharge, even though he's not stable. So we'd be looking for a physician and a respiratory therapist to follow us, because the places that the discharge planners want to send him to are death traps too. But I do know that he hasn't felt safe in that hospital for a very long time. The last time we talked, he told me he wasn't afraid of what was happening to his body, but he was afraid to be in that hospital. And that disturbs me greatly. So I'm
Should
trying to
never
do
happen.
everything I
Should never
can
happen.
to get him out.
You certainly are. Nicole?
Absolutely. I just want to thank everyone for their time and for listening. Please visit us at truthforhealth.org. We're here for education and support. Please use our resources. We have lots of learning materials on there, and don't hesitate to reach out to us. I can be contacted by email at nicole.landers@truthforhealth.org. Our sole goal and mission is to support the public, and I'd love to hear from you.
Absolutely. Well, Lori, we certainly wish your husband the best and wish you the best. And I hope you have
Thank you.
a much better outcome than I had. And he's hanging in there for this long. So, let's hope for the best. And I know you have your church behind you and everything. You have your faith. Nicole, keep on doing the great work. You're doing a lot of good stuff out there. And thanks everybody for listening. Dan Plamick, I didn't get to you. Thanks for talking about Tim Kelly. Thanks, Chris Buckman, and certainly Carolyn Goyda. Thanks for the kind words. Thanks everybody for listening to I Protest. Keep sending forth those tiny ripples of hope. Be with you next week at the same time. Thanks for listening.